This is a 70-year-old male with a past medical history notable for BPH with lower urinary tract symptoms and urinary retention. He required repeated Foley catheterization and CICing somewhat intermittently. He notably began passing whitish secretions while urinating a few months prior to presentation, and found that these secretions were periodically obstructing his urinary flow. As a result, he underwent office cystoscopy, which demonstrated a large white lobular mass adherent to the dome of the bladder. This mass was greater than 6 centimeters in size and was associated with air at the dome of the bladder. There was no clear view of a fistula or any other source of this whitish substance, but visualization was highly limited because of the size of the mass. As a result of this finding, the patient was taken to the operating room to undergo cystoscopy with extraction of a presumed bladder tumor versus other foreign body. Because of the soft nature of the mass, we elected to use a 24 French Wolf resectoscope. We then transitioned to an offset cystoscope through the Wolf resectoscope and inserted the Piranha Morcellator. We then used the Morcellator to evacuate the white debris as well as the gas. We first noted copious quantities of smooth white spherical debris. This material was very soft. In addition, there was diffuse white papules all across the walls of the bladder. We didn't note any other masses or foreign bodies, and again did not notice any evidence of a fistula. The Morcellator very easily cut through the soft mass presence and made quick work of this surgery. Once we were done, we then took a sample of the whitish papules on the bladder wall. Biopsy of the bladder wall demonstrated only chronic inflammation and reactive urothelium without any evidence of fungal organisms. However, the bladder mass itself, which was evacuated and also sent for pathology, noted numerous fungal organisms with yeast and pseudohyphae, most compatible morphologically with Candida. Due to the severity of the patient's BPH and urinary retention, he is now planned for a whole-up surgery within the next few months.